Hello and good evening, everyone. We are so excited to have you joining us today for our webinar, Making Your Shelf Studies Count towards Step 1, Step 2 CK Success. My name is Moses. I am a medicine intern, and I'm here with my colleague and friend, Mike. How you doing, Mike?
Hey, I'm doing all right. How about you?
I'm doing well. And just so everyone knows, I'm going to embarrass Mike right now. It's actually his birthday.
Oh,
So if all of you present could send him a happy birthday message in the chat, I would be very grateful to you all. We are both tutors and have worked with a number of students in a sort of personalized way, and we're thrilled to be able to chat with you today on this topic.
and thank you, Moses, for the birthday wishes, and thank you to everybody in the chat as well. It really means a lot.
Amazing. So on to more serious topics. Today, what we really hope to do is provide you all with an overview of the core clerkships, talk a little bit about how we might optimize your study time. Often different phases of med school require slightly different strategies, and we hope to share some of those with you today. There are a wealth of resources that you could use. One size definitely doesn't fit all, but there are some that are of particular utility in different stages, both within the clerkship year and with different exams. And then chat a little bit about how prepping for step 1 and step 2 are the same in some respects, but how they differ in some other important aspects. And by way of introduction, I just wanted to share a little bit about who we are at MST. You know, the core bedrock of what we do is online tutoring, and that really extends all the way along the pipeline from pre-medical students through preparing for the boards. And we've had over a decade of student successes, and in fact have had prior tutorees become tutors. And I hope you can tell that maybe I'll speak only for myself, but I'm a huge nerd. I really enjoy chatting with students about not only the basic science, which can be very exciting, but also thinking about how we can work together to really optimize your learning. It's on the screen, you see both our cute doggo, as well as a number of the other tutors who work closely with us. And with that, I'll turn it over to Mike to talk a little bit about maximizing clerkship studies.
I think the most important thing to state up front is that clerkships are clerkships, and they can be challenging. Specifically, they are pretty demanding on your time. And so it is important to be very deliberate about how you're going to be using your time, knowing that it is a limited commodity and something that you have to use wisely. As you prepare for step 1, as you had prepared for step 1 at one point in time, depending on where you are in your med school curriculum, there are a set of resources that you would typically use that are kind of standard. Diving into step 2, though, and your shelf exams, you'll find that there are less necessarily concrete go-tos and more of a tailoring of your study experience to how you learn best and the specific clerkship that you're on. We'll give you a play-by-play for every single clerkship about what we recommend in terms of thinking through the specific resources that we like for different clerkships. I think that overall, though, one overarching theme that you're going to see us emphasize over and over again tonight is to prioritize things that really engage you in what you're trying to understand and what you're trying to learn. And specifically, that's going to come in the form of making very good use of question banks, as well as other resources that, again, you identify as ways that help you engage in your learning. Flashcards, writing things out. Ultimately, what we want to encourage you to avoid is kind of passively reading straight from a textbook without necessarily trying to understand what you're trying to understand. If you have taken step 1, then you can use a little bit of that experience to help you identify what works best for you. Also recognizing, though, that they are different exams. There is quite a bit of overlap between the two, but you do need to approach step 2 through a step 2 lens, and we'll give you guidance in how to do exactly that as well. Without any further ado, then we can dive right in. And Moses, do you want to tell everyone about how would you recommend preparing for the internal medicine shelf exam?
Yeah, absolutely. So obviously, I'm in internal medicine. It's what I really love. One of the challenges of internal medicine, which is true increasingly in medicine generally, is just the breadth of knowledge that you have to have at your command to really do well for the internal medicine shelf. And so often that involves really having a core sort of question bank resource, and UWorld for Step 2 CK really fulfills that function. And even if you look at the question bank, you'll notice that 40 to 60% of all the questions in that question bank are internal medicine. Again, just reinforcing this idea that the breadth is really important. Like Mike was saying, there's a variety of textbooks that one could use. Step Up to Medicine has been sort of a tried and true staple. You can use online med ed or other sort of video formats if that's how you learn best and how you retain information best. And as we go through, you'll see that different clerkships really focus on different organ systems. So for medicine, thinking like cardiovascular, pulmonary, GI as being really the meat of the shelf. But again, as will be the case for all the core clerkships, getting used to the vignette style question and being able to quickly figure out if it's a diagnosis question, a management question, sort of an epi question, will really serve you well for this sort of examination.
Absolutely. And I think just to echo exactly what Moses said, this is honestly, if you look at the breakdown for question content on Step 2, at least 50%, if not the majority of questions, are going to come from internal medicine. And so this is the shelf that will help you the most in preparation for your exams, and specifically Step 2, but to a very large extent Step 1 as well, because a lot of the content that you're going to see on Step 2, you may not have questions like what is the next step in management, but diagnosis, treatment, pathophysiology of these diseases, all of those are often going to fold into the internal medicine shelf as well. Kind of dovetailing off of that into the probably next largest block or broadest topic would be the surgery shelf. And I think the most important thing here when you're thinking about how to approach the surgery shelf is you're not going to be tested on surgical techniques. How would you do a Whipple or resection of X, Y, and Z, some neurosurgical procedure that you had seen as a medical student. The key things that they're going to be focusing on in the surgery shelf and in the surgery aspects of Step 1 and Step 2 CK are going to focus on the medical management of surgical patients, preoperative evaluation, intraoperative complications, post-operative management and complications. And so you're not going to have to discuss which type of knot you would use, but rather, what is the cause of this post-operative fever? Or how would you think about small bowel obstruction versus post-operative ileus? The resources that are going to be focused on here, again, you're going to see a running theme. UWorld is going to be the most important thing. They've really expanded the section for surgery, and it's become much more of a go-to kind of resource. It already was, and is even more so now, with I think upwards of 4 or 5 times the number of questions and many more learning opportunities. Carlos Pestana put together a collection of vignettes that Kaplan has kind of packaged into this textbook. And this is a very, very, again, you're going to kind of see that every single shelf has kind of its own flavor of how you should prepare. And this is the unique one for surgery. He does a great job of really highlighting the most important things that you want to focus on. He's not going to give you a deep, in-depth understanding of many of these things, but it's an excellent way to get a broad swath of the territory, if you will, to create the scaffold that you fill in the blanks with the UWorld and potentially with the online med ed. The advantage of surgery is that it is a little bit, it's the same, oftentimes, depending on your curriculum, it can be anywhere between 2 and 3 months, which is about the same time as internal medicine. There's not necessarily quite as much to unpack with the UWorld and the Pestana, and so you will have potentially a little bit more time to explore some other resources as well during your surgery clerkship. I'm a huge proponent of questions. And so I really liked the AMBOSS for surgery. And that's really actually how I initially, as a medical student, discovered it. And so I typically recommend students that I'm working with for the surgery clerkship to look into AMBOSS if they've exhausted the UWorld. I have surgical recall, I think, is a little bit more geared towards more surgical management, surgical techniques that might be a little bit more outside the realm of what you probably would see on the surgery shelf. And then these other ones are other good resources to consider too as kind of second tier. Moses, do you have any other suggestions or thoughts about how you approach the surgery shelf?
I think that you've really hit the nail on the head as far as the medical management of surgical patients. And also just to recognize that in many cases, internists and surgeons are working together in the same disease entities. You know, there's debate now about whether you can treat appendicitis just with IV antibiotics versus whether you always, in every case, need to perform a surgical procedure. And so for that reason, there are certain areas that sort of bleed into each other. I mentioned how cardiology and GI and pulm, for instance, are an infectious disease, are big in the medicine shelf. But again, if you're looking for more questions, depending on the order in which your clerkship year is evolving, you might want to do some GI medicine questions during your surgery shelf, because again, a lot of these diseases are being co-managed in real life, and therefore they're tested in sort of similar ways. Other than that, I think you hit on everything really nicely.
That's such a great point.
So pediatrics, you know, kids are just little adults, and I will get. I know there's a pediatrician who's going to like jump out of my closet. And,
You're playing with fire right now.
it chastised me for this, but I think it would be fair to say that the way that you approach the shelf, maybe I'm going to walk this back a little bit. The way that you would approach the shelf is somewhat similar. I mean, if you think about it, while you know children have a diverse sort of clinical experience based on their developmental stage, and you know the epidemiology for sure changes quite a bit, and the sort of presentation of even similar illnesses. The resources from a testing perspective are often quite similar. And again, you'll hear for every single clerkship that we keep coming back to questions, which I think is essentially the bedrock of every rotation. And so UWorld is certainly very, very good. I actually did personally use blueprints for pediatrics, and I thought it was useful. But again, you'll notice that there are a number of different both texts and sources of questions that you can explore. And I'll make this point just to freshen it up a little bit. I'll make this point that it's not like if you liked Case Files for one clerkship, you have to stick with it for every single other clerkship. Find what style of text works for you, and you can explore a little bit, and don't feel bad if you know you spend a couple of days with the text and it's not working for you. You can try different things out. What I would really aim for, though, is making sure that you're hitting the questions hard. You can afford to sort of explore a little bit as far as the text and find something that works for you, but just getting those reps in terms of the questions is really pivotal. Do you have anything to add, Mike?
No, I think that's a great point, that you always have to kind of tailor and try to figure out how best to approach each of these, and don't be afraid to jump ship if something's not working. And so we'll keep marching through and move on to OBGYN. Yet again, like a broken record, I'll keep saying the UWorld is going to be front and center. I think one other thing I would throw on here in the main resources that we don't have listed, but I do feel pretty good about, is a question bank that is published by the American College of Obstetrics and Gynecology. It's a series of, I think, 300 or 400 questions by ACOG that are very well done, kind of march through the different areas of OBGYN and give you kind of a nice summary to supplement the UWorld. Online MedEd is another great resource again. Actually, when I approached the OB clerkship, I really leaned into the questions in online MedEd more than anything. And so it's, I think that the blueprints I had used a little bit of, and actually it was one thing where I had jump ship. I recognized that it was not really a way that I had learned very readily. Some people really benefit from it. And so again, it's a matter of trying to figure out what works for you. And if it works for you, then phenomenal. And if it doesn't, that's fine. Reevaluate. It's not a one size fits all kind of deal. Again, AMBOSS is gonna stand out there if you need more questions or you want more questions. You have the time to. And then Case Files and Beckman is a unique one here that is often used in the OB clerkship. Moses, anything else, any other thoughts about OB and approaching OB?
I would just second UWise, which is, I believe, the name of the ACOG question bank, just to put that out there. Really excellent resource for OB-GYN. And that brings us to psychiatry. You'll notice recurring themes. So I'll allow all of you to read this slide. What I would just plug at this point is that psychiatry is a truly fascinating field, and a lot of the sort of cognitive effort is to try to put a patient into a diagnostic category based on the specifics of the history, more than labs and more than imaging, and really becoming comfortable with the criteria that is used to diagnose these different disorders. It can be very subtle. It can be the difference between 2 weeks of a symptom versus 6 weeks of a symptom. And that can change the diagnosis that you're able to give a patient. And so I would really encourage whatever resources you're doing. Of course, I'm going to plug UWorld again. Of course, I'm going to tell you about all these books. But really, whatever mechanism you use to sort of remember these different categories, I think that unfortunately some people get to the shelf and they don't have these things memorized. And it can be quite a challenge to do well on the shelf without knowing like the difference between schizoaffective and schizophrenia and brief psychotic disorder. They're all on a spectrum. Knowing how to differentiate between these different entities, I think is really essential for your success. I don't know if you have anything else to add, Mike.
You said that perfectly. And I think that point just cannot be emphasized enough. If they don't have 5 out of, you SIGI caps, you just count them off in the vignette, look for the timeline. In the real world, it may not ever be that cut and dry, but on this exam, it will be that cut and dry. And if they do not have 5 out of the 9, they do not have MDD. And it is as simple as that on this test. And so it is absolutely crucial that you know those diagnostic criteria. And then the other side of psych is then the farm. And really, if you've got those 2 things down, it's a recipe for success on this exam. Just to kind of summarize all of this and put it into one slide, if you want to have one area where you're going to take down notes or take one thing away, is, again, we've kind of emphasized as we went the different flavors of resources that we recommend for each of these. Again, the UWorld is going to have to be front and center in all of this. We don't have it specifically spelled out here, but I hope that up until now we've communicated effectively that that's going to be the most important thing in your preparation. And then, as you're going through these different clerkships, this may become a little bit more intuitive, or you may recognize because of repetition what's important. But there are going to be the bread and butter things that are going to be showing up again and again in your clinical experiences, in your clinical encounters with patients, in the questions that you're doing, in the textbooks that you're reading. So in internal medicine, understanding the clinical features of a heart failure exacerbation and how you treat it. What does pneumonia look like? Which antibiotics do you choose? If you're on your EM clerkship, you're going to be, again, dealing with all the spectrum of thinking about types of shock and how you want to manage that. Are they a volume down? Are they volume up? I think that to emphasize a couple other highlighted ones, we talked about psych and the diagnostic criteria, psychopharmacology, and then family medicine, I think, is one that we didn't necessarily hone as much in on. Case Files is a great resource for that one. And then that shelf comes with one of the main things you want to take away in preparation for that shelf is become very well acquainted with the USPSTF. They are your new best friend during your family medicine clerkship. And what they recommend is gold. It's written in stone, and you need to know it cold about when you're going to get that CT scan to evaluate for lung cancer, who's getting an ultrasound for their AAA, and then who's getting a statin and which statin and for how long. You need to know all of those things like the back of your hand to do well on that family medicine clerkship. What do you think, Moses? Any other ones you want to highlight or point out?
I really love how you've added some pearls here. I would just want to conceptualize and contextualize what we're doing here. So some of you might have already taken step 1, and the real big jump in cognitive effort will be the increased complexity of the vignettes, the introduction of just a hint of diagnostic uncertainty where you're dealing with probabilities as opposed to certainties. In contrast, you might be well into your clerkships. You're looking forward to both exams, and it's a little overwhelming. It's been a little while since your basic sciences. But what I really want to emphasize is that your knowledge base is growing and expanding along multiple dimensions, and this will aid you, right? Like if you've done your clerkship and you haven't done step one yet, and again, this is stuff that we'll highlight later, you're likely going to be more comfortable with the clinical vignettes because you've seen this in the flesh, so to speak. And you'll be able to layer on that basic science in a way that feels very natural. You know, in contrast, if you spend a lot of time working on the basic science of pharmacology, when you get to psychiatry, at least the words are familiar. You know some of the mechanisms. You know, once in a blue moon, you will get sort of maybe a more basic science slanted question, and you that may be hearkening back to prior studies. And so I think there's a lot of anxiety that can come in terms of timing and sequencing of these things. And what I think we hope to do over the next a little while in the rest of the slides is to show you that no matter where you're starting, there is a path to success for you, as long as, you know, you're working hard, as I'm sure everyone here is, you know, very passionate about the route that they're taking. If you know, UWorld showing up on every slide up until now hasn't been a big enough clue that we're fans of the question bank, let this next couple of slides really cement that home. And I think instead of, you know, going on like a broken record on that, I'll go back to something that Mike was talking about from the very first slide. And that was that you have to be very efficient with your time. Your time is a precious commodity, which means that, you know, in a safe manner, of course, as you're walking, you can be doing flashcards. As you're waiting in line, you can do a question. Now, obviously, you need to be well and you need time off and you need to have balance. But the goal, as the slide says, is to really go through the entire Step 2 CK question bank during the course of your core clerkships, whether that's your third year or some other time during your curriculum. And being really creative about how you get that done, especially in the face of so many other pressures during the year, is really, really critical. And thankfully, there's been an expanding set of resources, both the desktop, the app on your phone, you have flashcards that you can make within the UWorld application, and new innovations that are continually sort of being rolled out, taking full advantage of all of these different resources.
And I think just one area that might be challenging to navigate with the UWorld is specifically on your internal medicine clerkship. Just be on the lookout for the fact that that is the one where it's going to be the most UWorld-intensive. It comes with the most questions. It's, of course, the broadest topic. And so just be very diligent upfront about your studying, and think about how long you have, how much you have to get through, divide it all out, and know what you need to get done each day. Because that's going to, again, be very important both for your medicine shelf and for step 1 and step 2 down the road. Some other things that, in terms of thinking about how to approach the UWorld, is find ways to incorporate that. In of itself, it's a very active form of learning. And you can further kind of develop that by incorporating components of the explanations into your flashcards and into your daily studying. Don't turn explanations into a textbook. Don't copy and paste and try to just passively read them in your free time. But while you're answering questions, you can use tutor mode to help get immediate feedback and learn what you need to pull down from vignettes to understand how to get that question right in the future. And then if you're going to use flashcards, then you know, what I often recommend to help you maintain efficiency through this is really, if you are constantly learning things you didn't know before, again, with the understanding that your time is limited, you're operating at 100% efficiency. And you can't be any more efficient than that. Like, that's the extent of what you're going to be able to accomplish. And so it may feel like you are not synthesizing enough from the questions that you're working through, or you need to spend longer on each question. You have to at some point balance quantity and quality. And all of that's to say is, don't spend like 30 minutes a question, because this is a pitfall that I've fallen into and many of my students have fallen into, where you're ending up spending so long, going through so little, that you don't get through the breadth of what you need to learn. So what I often say is, like, pick 1 or 2 facts from a table, from a explanation paragraph, from the educational objective, put it on a flashcard, make that what you learn. Anki is a great resource for this because it incorporates spaced repetition. Here at MST, we often recommend Memorang 2, another great resource. But find what works for you, but also helps you maintain your efficiency.
You know, and the only thing I would add, Mike, is that often finding out what the central point of a question de novo can be challenging, and it takes a lot of reps, a lot of practice to sort of see the man behind the curtain who designed the question, what they were going for. I've worked with students in the past for these types of tests and have recommended thinking about a couple of things. One, scrolling to the bottom of UWorld and looking at what the educational objective is. Usually 1 or 2 sentences. That's what the test writer is really trying to communicate. Another question that I have asked myself and I encourage my students to ask is, what piece of information, if I had known it, would have allowed me to answer this question correctly? And if you can identify that one gap in your knowledge that would have transformed an incorrect question into a correct question, and you're able to put that in a flashcard or write it down in a notebook or just reflect on it and then remember it, whatever you have to do to remember that one fact, that's one question that potentially would have gotten wrong on your actual exam that you now would hopefully get correct. Because it can be very difficult. Often you read an answer description and there's like, you know, it might be a dyspnea question and there's a fact about heart failure that you didn't know, and there's a detail about how you triage pneumonia that you didn't know, and maybe there's a pharmacology about COPD that you didn't know. It can become very overwhelming in the face of the amount of learning that we all have to do, and finding ways to hone in on the key knowledge gap can be very helpful.
That's so true. It is, the explanations in step 2, in the step 2 QBank especially, can go on for quite a bit. And I agree 100% with that point of the educational objective can be very helpful to help you distill down what you need.
You know, I have put here on this slide a number of other resources. And I want to emphasize again that we're not being prescriptive here, in the sense that we're not saying you have to read every book on this slide in order to find success. Instead, it's more of a buffet, and we're sort of putting a number of high yield resources out there. Case Files is excellent, as is PreTest. They can be targeted towards either specific clerkships or specific topics. And I'll be honest, there are some clerkships where I personally just felt like the learning from the question banks was so dense, so rich, I didn't feel like I needed to spend a lot of time on textbooks. And there were others where I really needed that foundational sort of ground setting. And Case Files, like for instance, neurology was a particular weakness of mine. And so having a little bit of extra something in the background was very helpful. I don't know if, Mike, you found any of these particularly helpful for you.
I think I kind of pick and chose based on the clerkship and the time that I had during it. And again, I think to your point exactly, this is not necessarily saying like, if you don't do this, then things will not go well. It's just, here are what we have found that work for people. And it's a matter of kind of tailoring to your learning style what you find will work for you. All right. So I am a firm believer in the title of this slide. Both Moses and I were in a cohort that took step 1 after clerkships in the 3rd year. And I think that it's not to say that if you now don't take step 1 in your 3rd year, you're also at a disadvantage. I think it's just different ways of approaching it. But regardless, the point is that you shouldn't necessarily feel like being removed from your preclinical education will hurt you. What I often find is that first of all, having prepared for the shelf exams in the ways that we've discussed so far, in many ways helps gear you towards preparation for step 1 and of course step 2 CK. You have a clinical context for so much, and that honestly, it may not feel like you're learning. I felt frustrated during clerkships because I felt like I was having difficulty comprehending how quickly I was learning or how efficiently I was learning. I felt that if I just sat down with a textbook, I would learn so much more quickly than standing on rounds. But the reality is having that clinical context just helps you hold on to information so much more readily. In the course of thinking through patient presentations, developing differential diagnoses, you become very comfortable with the quote unquote illness scripts or natural histories of these different diseases. And it helps you pick out the important things that you want to be thinking about as you work up different conditions. Even more than that, you just get comfort with UWorld, how to approach UWorld, how to answer questions. You get very comfortable with vignettes. Our tests are very unlike the tests that, frankly, any other student takes. We have everything is couched in the context of a clinical vignette. It's almost like every single question is a case, and it's different. It's different from undergrad exams. It's different from the NCAT, and so you have to develop a degree of familiarity with that. And the beauty is that as you work through clerkship year, as you work through step 2, as you work through the UWorld for each of your shelf exams and then take the shelf exams, you get a lot of comfort with that kind of thing. It helps you for step 1. It'll help you for step 2 CK. What do you think, Moses? Do you feel similarly?
I totally agree. As you mentioned, Mike and I were actually classmates, and I feel like the experience of both of us and a lot of our classmates was that getting to see this stuff in person, having the experience of just doing a lot of questions in vignette format during clerkship year helped for step 1. That being said, I distinctly remember being in my early clerkship experience and feeling like, man, I really wish I could have had some time to just like run through all of the data again before jumping into clinicals. My experience has been that if you go into whether it's step 1 or step 2 or shelf studying with preserving as much of that excitement for learning as possible, and then using all of your prior experiences, whether it's just finishing your basic sciences or whether it's a richness of clinical experiences, and leaning into that as much as possible, whatever that background is, that can be very, very helpful.
And I think one other, I think that was beautifully stated. And I think if I can just state one other caveat, the only aspect where it could come at a little bit of a disadvantage is the very, very, very basic science that you are pretty removed from by third year. I had to relearn a lot of the biochemistry just to state it, and it's just a thing, and you do it and it'll be fine.
The other things to just point out, and some of this is logistics, and obviously these are fluid, and you want to keep up with what your school is saying and what the professional organizations are doing. Thinking about how your step 1 score, whatever it is, just the presence of that score, how that impacts your ability to get electives. Thinking just about yourself, who you are, the kind of rest that you need. There's a lot of examinations in medical school, and sort of the way the schedules shake out, you want to watch out for exam fatigue. And really hitting on what Mike was saying about the basic sciences. And in fact, one of the attendees has a question sent our way asking about how you keep up with the basic sciences. And I will tell you that there's no perfect answer here, and I'll give you my take, and then I'm very curious to hear what Mike has to say. So I would say that your job as a clerkship student is to be a good clerkship student. It doesn't really matter whether your program has pass, fail, or honors during the clerkships. At the end of the day, you want to really learn as much as you can from the clerkship experience, because it all sort of builds on itself. And so your number 1 priority as a clerkship student is to show up for your patients clinically, to show up for your team and like be as useful as you can possibly be, and to do well on your shelves. Now, to the extent that basic science comes up in the clinical year, I would say lean into that. Sometimes, the basic science really makes its way in a dramatic fashion into the workup of a patient with a unique presentation, and take those opportunities to review. For example, I remember on peds, I had unfortunately some kids who had congenital malformations that were just classic from the basic science and embryology literature. I'll tell you what I did personally. In the first 6 months of clerkship year, I didn't study in any systematized fashion the basic sciences. As I became more comfortable in my role as a clerkship student, I dabbled a little bit. I tried to remember things here and there, but I will tell you that a vast majority of my colleagues did none of that and got exceptional step 1 score. So it's in no way required. And I will say that it is frightening sometimes to think, wow, there's just such a volume of information that I'm forgetting. But I'm here to reassure you that it is very doable to relearn it. And the key is the re part, because it's already sort of encoded in your brain somehow. You're just sort of bringing it to the forefront. I'm curious what your take is, Mike.
I agree 100%. And I mean, I can tell you that I personally just deep dived into the clerkships. I didn't really worry about the biochemistry behind it. Even on, as you were discussing, like with peds, thinking about galactosemia, I was only thinking about the clinical presentation of galactosemia. I just didn't have the bandwidth to think about, this is the enzyme that's out and this is why it presents the way it does, and here are all of the variants, whether it's this enzyme or that. Those gaps you'll have time to fill in later. And your objectives during your clerkships and during the preparation for that shelf exam should be to learn that. You're creating a scaffold, and you're going to fill in the blanks at a later point in time. You've already learned a lot of it, and it is there. And it may, just as Moses was saying, it may not be readily apparent, or you may not be able to recall it immediately, but that's the whole entire name of this game, is it's learn and forget. And every time you relearn, it's just a little bit easier. And so the bottom line from my perspective is, don't stress. You have a dedicated study period. You'll be able to incorporate all of this at that time as well. But that's a great question.
You would think I'm getting paid personally by UWorld. I assure the audience that I am not. But really, the source of questions is so key, and UWorld has long been sort of the gold standard for high quality questions and the answer descriptions that come with them. First aid, obviously, has been the Bible for step 1. And then thinking about selectively identifying supplemental resources. Sketchy Micro has just, I remember when it first came out when we were med students, and now it's become the de facto gold standard for microbiology, and increasingly being used for other things like pharm. Pathoma, again, an excellent resource delivered from a master pathologist. I would say those are the bedrock of most dedicated study periods. And of course, depending on targeted areas of weakness that require additional firming up, thinking about lectures from Boards and Beyond, thinking about physiology, for instance, from BRS. And I will say that this is often personalized. It's easy to list in tabular format the different resources. How you put those puzzle pieces together is often as important as which resources you use. You can have you can buy the best resources in the world, but if you're not using them in a schedule that makes sense, if you're not able to keep to a schedule, or if you find that you're burning out on the schedule that you have, it's not going to do you a whole lot of good. So you sort of need all of those things to fall into place so that the product at the end of the day is truly reflective of your talents and of your time.
Absolutely. Again, the key point is these are supplemental resources. Just make sure that you're using the core content that you need to be focusing on, and never let videos, for example, come at the expense of making sure that you're marching through the UWorld at a good pace. And so just to dovetail off of what Moses said perfectly, and apply all of that to step 2, again, the UWorld's going to be where it's at. So by the time you've worked through, the beauty of tailoring your shelf exam studying and having the endpoint of step 2 CK in mind is that if you are focusing on the UWorld throughout the course of your clerkship year, I think we had mentioned it on a slide without explicitly stating it, you will have worked through the UWorld. You will have done one pass through the UWorld by the time you get to your dedicated study period. for step 2. And that's incredible. That's great. I mean, you've already been exposed to a whole the whole breadth of questions. What I often recommend is to take a step back and try to work through it again, because you are a little bit removed from the questions that you had done that time 1 year ago. And so I think it is worthwhile to try to focus on getting through at least as much of a second pass as you can, if not more. Online MedEd, again, is a great resource that we've been focusing on again and again. And then other things that you're going to see here are going to be variations on the different resources that we've recommended for each of the shelf exams. And again, you can see how tailoring your preparation for the shelf exams is, in a way, really setting yourself up for success on Step 2 CK. Pastana surgery notes. Step Up to Step 2 CK is, in a lot of ways, very, very similar to Step Up to Medicine. And a lot of the content, blocks of text, are directly in one and the other resource. Other options that you have are first aid for Step 2 CK. I'm going to be completely honest with you and be a little bit critical. I don't find that this is quite as useful of a resource as it was for Step 1. I don't routinely recommend it the way that I do for students who are preparing for Step 1. Again, just as Moses was saying, find what works for you when it comes to these supplemental resources. Know that it's okay if you start leaning into one and finding that it's not really going well. You can always try to jump ship to another one, and that's perfectly acceptable. It's better that way. Any other thoughts, Moses, how you prepared for Step 2 or recommendations?
I mean, I think that the graphic really says everything. UWorld is at the pinnacle of this. And I'll just say that there are some students who only use UWorld for Step 2 CK study. Now, do I recommend that for everyone? No. I think having some of these other resources can be particularly helpful, especially as you know yourself, right? And you know what's a weakness or not. But I mean, students have done very well with just Step 2, with just UWorld. So I can't emphasize that enough. And that really brings us to the timing. And as in all things in medicine, you could always, it's sort of a balance. You could always do more, but more isn't always more. That was a convoluted way of saying that resist the urge both to postpone and to prolong unnecessarily your Step 2 CK study. You really want to be in that Goldilocks zone, right? Not too much, not too little, not too early, not too late. And what do I mean by that? I mean, the closer you are to your clerkships, the closer you are to the primary experience that is informing Step 2 CK. And you want to retain some of that muscle memory. At the same time, you don't want to burn out. So if you need a little bit of a break, far be it from me to sort of say that you have to go full ahead with no breaks and, you know, your wellness, not be mindful of your wellness. So in general, the sooner you can do it, the better. Don't burn out, and use those core resources. And I think you'll really set yourself up for success.
Agreed, 100%. This may be intuitive, but it is important to make sure that you're continuing to assess where you stand. And regardless of which exam you're studying for, Step 1 or Step 2, it's important to focus on, to do a self-assessment, get an idea of where you are, and then compare that to where you want to be. And so for Step 2, there are 3 NBMEs that you can use. There are also 2 UWorld self-assessments. And so I think it's worthwhile to make sure you're utilizing these resources and focusing on the important content, the information that you gain in terms of the 3-digit score your performance translates into. And then I think that this kind of, again, emphasizes the point that Moses had brought up. The key thing is you're never really going to walk into, frankly, any of these exams knowing everything that they could possibly test you. The reality is that there's just so much. There's 1 billion and 1 things that could test you on. And you really have to make it your mission, not necessarily to try to learn all of that, but just to try to learn as much as you can. But at some point, you need to draw a line in the sand and say, this is where I stand. I have practice test data to support that I'm at my goal. I put in the time and done the things that I had set out to do from the very beginning. The point is you need to be able to say, this is it. This is the time to take the exam. And what I often counsel people against is to this point here, they might have scheduled their exam right before a sub-internship or an away rotation at an institution they want to match at. And the reality is that if you reschedule your exam for after that rotation, you're not going to be studying during the rotation. And if you are, it could come at the expense of your performance on it. And so all you're really doing is further spacing out the amount of time from when you first learn the content. You're only hurting yourself. And so really be deliberate. It has to be a very deliberate, conscientious decision that you know that you are not in a place to take the exam. You have data points to support that sentiment. And you have the wherewithal to be able to move it to a time when you can get to a better place. I think, Moses, you said that better than I did before, but do you have any other thoughts about this?
Humility in all things will do you well, right? That combination of humility and confidence will really take you far. And I think what you said was beautifully said. I just really want to emphasize at the close of this that it's truly a marathon and not a race. Not only each of these exams and clerkships individually, but just really the whole net school experience taken together. And I would just emphasize that Mike and I, we've really tried to strike this balance between giving you all insights that are, broadly applicable, that are general to med students in various situations. We know that not only is diversity in where you all are coming from, nationally, internationally, med schools that adopt a variety of curricular philosophies, but also right now, I think we're all sick of hearing it and sick of saying it, but the disruptions that come with the pandemic, the differences and the adaptations that we've had to make as institutions and as people to respond to this have been really challenging. We're all in this together. Sometimes to give advice that is more personalized, it's useful to have a longer conversation. And just to throw out there, we've put the contact information on the screen, the email address, the phone number, the website. If you feel like just talking it out with someone would be beneficial for you, we're definitely here for you. And at this point, I'm just going to take a look at the chat. I don't know, Mike, if you found a question that piqued your interest.
Here's a good question that I think kind of touches very nicely on one of the points that we brought up earlier about exam fatigue. If you're taking step one after clerkship year, Moses, what do you think about the timing of step one in relationship to step two then?
I think historically folks have put step one first and then step two. But as we've been discussing today, they're very distinct exams. Can I imagine scenarios in which you would take step two before step one? Sure. And I think that folks can have some success with that. I think the bigger question, honestly, is to reflect on where you are in your school's curriculum, how you've done so far, what your strengths and weaknesses are, and then what series of exams moving forward will best capitalize on your success. So if you know that you are fresh off of clerkship year, you really crushed all the rotations, you really squeezed all of the juice out of step 2 CK, then that might be a good time to continue that momentum going and take step 2 CK. In contrast, if you're the sort of person that needs, like me, that needed a little bit of a change in perspective, and you're really yearning for that basic science, and you know that will motivate you, I know, Mike is smirking at me, then that might be the move for you. I don't know, Mike, if you feel differently, but as is often the case, this is so personal.
I agree 100%. I think there is, it may feel off the beaten path to take step two before step one, but really, frankly, step two, I honestly really think about it as your 5, 6, 7, 8 shelf exams all stapled together into one exam. And so you really have been preparing for these the whole entire time for step 2 CK. I personally also took step one before step two, and I thought it was fine. I think the bottom line is you just need to figure out how long does your dedicated study period need to be. What is your stamina in working through this? And are you able to go straight from a study period for step 1 into one for step 2, or do you need to have a little bit of time? And once you do that calculus and kind of have that conversation with yourself, just look at a calendar and see what's realistic and kind of tailor it accordingly. And so I think on some level you have to know where you stand in the calendar and what your calendar is, and then figure it out from there.
I'm seeing here questions about how much time is recommended for studying for step 2. And one of the reasons why we didn't put our nickel down on any particular time frame is, again, because it's so variable and it sort of depends on your personal situation. There's the old adage that step 1 takes 2 months, and then step 2 CK takes 2 weeks, and step 3 takes a number 2 pencil. And I hope that's true for my upcoming step 3 examination. But I think that may not fit your learning style and might not fit your schedule. For those who've taken step 1 in the past, you can use that as a barometer. Typically, you would need less time for CK than you did for step 1, and somewhere on the order of several weeks might be good for you. And I just want to acknowledge again that the diversity of experiences here. Some folks have a lot of flexibility from their school in terms of how much dedicated they get for step 2 CK. Others expect you to be doing a light elective, and that I think it's reasonable that would change the amount of time that you take preparing for the exam.
I think there's a question here on making flashcards. And how to go about incorporating flashcards from the UWorld and perhaps utilizing them. And what I would say here is, I think we kind of a little bit talked about the technique of using the educational objective. I think one thing I like to say on this topic when it comes to flashcards is, and it may be a little bit controversial, I'm not the biggest fan of some of the pre-made decks that you may find online. I find them a little bit I tried to use them myself. I've tried to work with students who were interested in them, and ultimately we together came to the conclusion that it wasn't effective. They're just too overwhelming. There are too many of them, and the reality is that the act of making flashcards in of itself is a learning experience. The act of making flashcards tailored to what you don't feel comfortable with and what you want to focus on helps make a deck that is very specific to you and what you need to focus on, in a way that a 10,000 deck that you downloaded online is not going to be able to do. And so for that reason, I really do like to recommend, and I think many of my students would agree with me as effective ways of learning, to make your own flashcards.
I agree. The only pitfall to avoid, and as a disclaimer, I made my own cards preclinically. I made my own cards during clerkship year. I made my own cards during step 1 studying. So clearly I'm a big fan of making my own cards, and I sort of advise students to do the same, again, because it's targeted, because it's a more realistic deck to be able to get through and really derive the benefits from spaced repetition. All that being said, it's easy to get into a trap where you do a UWorld question, and then you spend the next hour making flashcards from that one question, and then you don't get through your UWorld. So how do you avoid doing that? I advise, at least initially, to be very disciplined. 1 or 2 flashcards per UWorld question max. Try that for a couple days. If you're able to keep up with that and you really feel like you can make more cards to supplement your learning, well, build up to it. But you don't want to end up in a situation where you're 1 week into dedicated and you already feel behind, because the way that you're creating the cards is sort of creeping into every other aspect of your studying. And so just keep an eye out for that. I used and made flashcards extensively. I think it's amazing. Just watch out for the ways in which it can go wrong.
And I think with that, just to highlight what Moses had said earlier, and just give you guys a little bit more of a perspective. We are here to support you in working through these times in your training. It's not easy, just to state it up front. The task in front of you can feel like a lot. you can do it, and we're here to support you along the way. And you know, honestly, what I love about being able to do this, being able to help students reach their goals and find success is really what it's all about for us. And we'd love to be able to do that for you as well. Feel free to reach out to us at this email address, the phone number here, and obviously that's our website. And know that we're in your corner.
Couldn't have said it any better. Really, just to reiterate what Mike has said, ultimately one of the greatest joys of medicine is to do this together. And whether that's together virtually, whether that's together on the wards as part of a team, whether it's interprofessionally, as I consult Mike for the third ridiculous derm question of the week, whatever that looks like, we're all in this together, and I hope that we get to interact in the future as colleagues. So with that, I think we'll wish you all a good evening or whatever time it is where you're at, and hope you have a wonderful rest of your day. All right, take care.